Honorable judges, distinguished colleagues, Assalamu alaikum and a very good morning. My name is Dr. Mohammed Faizan and I am currently doing my house job from the International Dental College. Today my topic of presentation is the biocentric burn, a term I use to describe how tobacco does not simply damage oral tissues but creates a continuous biological, neurological and environmental injury affecting the entire living system. To illustrate this, I'll begin with the clinical archetype. Consider our index patient, a 38 years old male, presenting with generalized stage 3 periodontitis and a suspicious leukoplegia. His health history reveals anxiety and failed quit attempts. Socially, he expresses guilt about the wider impact of his habit. In the oral cavity, we can see that there is a generalized stage 3 periodontitis and suspicious leukoplegia. Neurological state, the unmanaged anxiety and underlying nicotine dependence contributing to failed cessation attempts. Environmental impact, the patient expressed social guilt regarding his habits contributing to ecological harm and waste. Now we would be discussing about the molecular pathogenesis, the direct assault, carcinogens and host response sabotage. Tobacco initiates a dual mechanism of harm, direct cellular assault and critical host defense impairment. First, the direct carcinogenic injury. Tobacco contains tobacco-specific nitrosamine, particularly NNK, which stands for nicotine-derived nitrosamine ketones. NNK forms DNA adducts in oral epithelial cells, triggering oncogenic mutations and increasing oral cancer risk. Secondly, nicotine acts as a vasoconstrictor, reducing gingival blood flow and creating tissue hypoxia. This impairment causes and weakens immune defense, allowing pathogenic bacteria, especially Porphyromonas gingivalis, to dominate and accelerate periodontitis. The reinforced cycle, neurological hijacking and comorbid anxiety. Tobacco dependence is not a habit, it is a neurobiology. Nicotine stimulates alpha-4 beta-2 nicotinic acetylcholine receptors in the ventral tegmental area, also known as VTA, a key brain region involved in reward processing. This stimulation causes sustained dopamine release in the nucleus accumbens, reinforcing craving and dependence. Smoking temporarily reduces withdrawal-induced anxiety. However, oral disease-related shame and social stigma intensify stress, driving further consumption. This creates a self-perpetuating neuro-oral loop. Externalized pathology from our clinic to the ecosystem. The pathology does not stop at the patient. Cigarette filters are made of non-biodegradable cellulose acetate. They leach nicotine, heavy metals, and toxins into the soil and water system. There are different steps for the manufacturing of tobacco products. First is the cultivation, during which there is vast lands are used and deforestation is done. During the second step of manufacturing, high energy consumption and carbon dioxide emission throughout the curing and processing stages. During that step 3, consumption, the release of toxins into the immediate environment impacting air quality and public health. In the fourth step, waste and toxicity, cigarette filters composed of non-biodegradable cellulose acetate, as I already mentioned. Globally, 4.5 trillion cigarette butts are discarded annually, making them the most common form of litter on Earth. Thus, tobacco disease externalizes from the clinic into the ecosystem. Synergistic morbidity. The trifecta is a single disease model. These are not merely comorbidities, they are interconnected synergistic pathologies forming a self-perpetuating system. For example, oral and neurological symptoms are also connected. Addiction perpetuates exposure. Oral and environmental waste resists toxic load, oral disease stigma. Neuro and environmental anxiety drives consumption. Environmental guilt may heighten anxiety, complicating cessation. Neurological addiction ensure continued oral exposure. The resulting oral disfigurement deepens social stigma, reinforcing the mental health burden. Therefore, I propose a biocentric cessation protocol addresses all three domains. In phase 1, which is motivated prescribing, we would be begin with Fagerstrom test for nicotine dependency. This is a 6-question questionnaire. For scores more than 5, we initiate varenicline. This is a drug, a partial alpha-4 beta-2 agonist that reduces craving while blocking nicotine reinforcement. Or we can also prescribe bupropion, a norepinephrine dopamine reuptake inhibitor with careful screening for contraindications. And we would also do nicotine replacement therapy along with this and behavioral sequencing. The phase 2 collaborative care, integrating behavioral and planetary health. In phase 2, collaborative care integrates cognitive behavioral therapy, dental practice, and social support networks, as well as community green script initiatives. In dental practice, it would be the hub for screening, diagnosis, and initial pharmacotherapy. The cognitive behavioral therapy, essential referral for breaking the anxiety addiction loop and enhancing self efficacy. The social support network, connecting patients with local cessation groups. Community Green Script, a clinic-led effort for every 6 months cessation, the practice-sponsored native tree planting or local cleanup events. The projected outcomes, it would be a multi-system remission. We would expect a decrease in the oral health burden, reduced carcinogenic load, and measurable improvement in probing depth and periodontal stability. We also expect increased mental health, breaking of the addiction cycle, improved anxiety management, and restored self-efficacy. There would be a zero toxic waste contribution, and there would be increased ecological benefits, active contribution to the community and planetary health via the green script initiatives. Our expanded scope from oral cavity to One Health, our diagnostic acumen reveals a disease with oral, neurological, and environmental sequelae. Our therapeutic responsibility must expand. The dentist as a planetary physician. By adopting a biocentric cessation protocol, we move beyond being oral healthcare providers, we become essential practitioners in the planetary health, addressing the pathology from the cell to the ecosystem. This is our professional imperative.